Hi everyone, I wanted to talk about a particular kind of hair fall or alopecia in women known as pattern alopecia. So most of us know that women lose hair for many reasons. It could happen after childbirth, surgery, blood loss, after a bad illness like dengue, typhoid, COVID. It can happen because of diseases like thyroid problem, hormonal conditions like PCOD, because of nutritional deficiencies like anemia, B12 deficiencies, etc. But what is pattern hair loss? So have you noticed bald men that when they lose hair, they usually lose hair from the top of the head or their hairline starts receding back, but they always seem to retain a strip of hair on the sides and on the back. So something similar happens to women as well when we go bald. Of course, women don't produce as much testosterone in our body, so women never go quite as bald as men. But a somewhat similar process happens when women go bald as they grow older, where if you look at a woman from the back of her head, it looks like she has a lot of hair, but when you check her hair from the top or from the sides, you can see that the hair on the sides is thinning. When she's pulling her hair back in a ponytail, it is starting to show that the sides and the temples are looking empty, and the top is looking thinner, the central partition is starting to look a little wider. This is called pattern hair fall or pattern balding because it's following a certain pattern. So usually it is age related. It's fairly common in women after menopause, but if it starts happening in the 20s or 30s itself, it could be hereditary. If your father or the men in the family are going bald, it can happen to the women as well. And of course, if you have the double whammy of hormonal issues, if you also suffer from polycystic ovaries or a thyroid problem, it can set in earlier. If you have suffered from chronic illnesses, if you're underweight, if you have nutritional deficiencies, if you have a very stressful life or a stressful lifestyle, then the problem sets in earlier. So there are multiple treatments, but among the main treatment, minoxidil as a topical solution to apply to the scalp, that is the gold standard of the treatment. Whatever else dermatologists may do, whether we add PRPs or whether we add multivitamins or hormones or different treatments, the minoxidil never goes out of the equation. Many myths abound. Minoxidil will make your hair dependent on it. If you stop, the hair fall gets thinner or even worse than before. These are all myths. Think of minoxidil as anti-aging for your hair. If you were to apply anti-aging creams on your skin, you don't think of when can I stop. You keep using it for a lifetime to keep your skin looking youthful. So if you want your hair to look youthful, and what is young looking hair? Hair that remains thick and bouncy and supple for a lifetime, you'll have to use minoxidil also for a lifetime. So for more information, please visit a dermatologist, get a personalized consultation. Do not assume that your hair fall is a regular hair fall. In fact, with pattern alopecia, a lot of women don't even have hair fall. It's just that year after year, when you look at old pictures, you can tell that you're losing hair volume and density. Meet a dermatologist to confirm the diagnosis and start treatment. It works best if you start treatment in the early stages.